Hello everyone, I am Nidhi Sharma, clinical instructor, Khalsa College of Nursing. Today I am going to present my topic on postnatal care. And what is postnatal care? Postnatal care is a care given to the mother and a newborn immediately after the birth and for the first 6 weeks of life. Principles in the management includes to restore the health of a mother, to prevent infections, to motivate the mother for contraception, to educate the mother regarding family planning. And there are some following interventions that mother and the healthcare professional should take care of for postnatal management. It includes immediate attention. In immediate attention, firstly we have to assess the general condition of a mother. It includes vital signs. In vital signs includes temperature, pulse and blood pressure. There is a slight increase in the temperature after within 24 hours after delivery, that is 0.5 degree Fahrenheit. Pulse rate pulse rate after delivery is 16 to 17 beats per minute, and blood pressure, there is no such changes present in the blood pressure after delivery, but if there is a hypertension it may be due to due to postpartum hemorrhage, and if there is a hypertension present and it is due to the postpartum toxemia. And if mother is feels hungry after delivery, we should only give hot drinks to the mother. Further, then is rest and sleep. Encourage the mother to take 8 hours sleeps during the night and 2 hours sleep during the daytime. And it's next is ambulation. And in ambulation, encourage the mother to ambulate within 44 hours after delivery to prevent further complications. Now, it's hygiene. Hygiene includes perineal hygiene. Encourage the mother to clean their perineal area 4 to 6 hours every 4 to 6 hours. Next is vulval pant changing. Encourage the mother to change their vulval pant as frequently as she needed. Next is breast care. In breast care or in breast hygiene, it includes encourage the mother to clean their breast while bathing or before and after the feed to her baby. And that includes diet. In diet, mother should encourage to take 400 to 500 kilocalories more diet due to lactational need after delivery, because mother should provide feeding to her baby, so she needs more diet during their postnatal period also. Then is care of bowel and bladder. In bowel and bladder care, mother should encourage to urinate 2 to 4 hours every 2 to 4 hours due to prevent discomfort, because discomfort cause further pains to the mother. Then encourage the mother to take fluid and roughage diet. Constipation. Encourage the mother to take sufficient roughage and fluid diet to prevent constipation. And after rooming in is to keep the keep her baby with the side of her mother's bed to promote emotional bonding with her mother. Postnatal exercise also encourage mother to do some light exercises after delivery. And after NVD, there is postnatal exercise started for 24 hours after NVD and 48 hours after cesarean section. What are the main objectives of the postnatal exercises? It includes prevent uterine prolapse, to prevent stress incontinence of urine, to educate the mother to assume correct posture while getting up from the bed, to improve circulation, reduce edema, prevent deep vein thrombosis, and to improve tone of abdominal and perineal muscles. And one is help to prevent backache. And so exercises includes deep breathing, head and shoulder raising, leg raising, and pelvic tilt. And further point is education. Educate the mother regarding self care and baby care. Baby care involve baby bath, baby clothing, immunization, weight gain of the baby, and physiological jaundice. Then is immunization of the mother. In immunization of the mother, it includes influenza vaccine, MMR, measles, mumps, rubella, Tdap, that is tetanus, diphtheria and pertussis vaccine, hepatitis B vaccine, anti-D gamma globulin vaccine, and human papilloma virus vaccine. Then the main point is emotional need. In emotional need, we have to assess the emotional need of the mother and provide the counseling if she needed. Encourage parents for the baby care. Show confidence in mother's ability and observe for the sign and symptom of postpartum blues. Now we discuss some of the minor elements that mother may suffer after delivery. It includes after pains, perineal pains, constipation, anemia, hypertension, lactation suppression. And then now we discuss this one by one with their management. After pains, it occurs 2 to 4 days after delivery due to uterine contraction and relaxation. It may be because of the certain reasons such as blood clots, increased parity, or breastfeed women. Management includes encourage mother to frequently urinate and empty the bladder because as we discussed earlier, that full bladder cause discomfort. And next point for management is massage the uterus to expel the clot. And further is provide analgesic and antispasmodic to relieve the pain. Then is perineal pain. In perineal pain, perineum area has to be inspected for normal pain or presence of hematoma or infection. In this, we have to provide cold and hot application to the mother. In this, ice pack, sitz bath, or infrared lamp therapy should be provided to the mother, and topical and anesthetic sprays or ointment may be used. And in anemia, we have to provide ferrous sulfate 200 mg to the mother. And for the constipation, we encourage mother to take fluid and roughage diet, or encourage if or for my on take mild laxative. And if there is a hypertension, encourage the mother to take antihypertensive drug after the order by the physician.